Trailblazing US Congresswoman Shirley Chisholm once stated that health is a human right, not a privilege to be purchased. Similarly, of the various international human rights in existence, we regard the right to health to be the most important for a variety of reasons. Firstly, a brief overview of the right to health and what it encompasses will be given, which will explain how it is provided for in domestic and international law. Secondly, a timeline of the development of the right to health will be outlined and the efforts to date to cement the right to health internationally. Third, an argument will be developed that assesses the importance of the right to health against other rights based on the concepts of generational and composite rights. And finally, the importance of the right to health will be illustrated with a specific example of the COVID-19 pandemic and the emphasis it now has placed on ensuring the right to health internationally. Health refers to that which all human beings are entitled to, regarding not just the absence of disease or infirmity, but an adequate quality of life, ensuring complete mental and social well-being. The right to health means the existence of other social and economic determinants of health, such as access to proper nourishment, safe and potable drinking water, the right to a home and privacy, and safe and dignified working conditions. In an international context, Article 25 of the 1948 Universal Declaration of Human Rights states, "Everyone has the right to a standard of living adequate for the health of himself and his family." Following this, the right to health has been expressly referred to in a number of core international treaties, most significantly the International Covenant on Economic, Social and Cultural Rights, which refers to the right to enjoyment of the highest attainable standard of physical and mental health. Other international treaties which refer to the right to health include the Convention on the Rights of the Child and the Convention on the Elimination of All Forms of Discrimination against Women. In the New Zealand context, there is no express right to health under domestic law. However, by ratifying the ICESCR, New Zealand has committed to the protection of the health of its citizens and to provide services, policies, and budgetary means to promote good health and ensure the elimination of health-based discrimination. This is achieved by a range of laws, including legislation directly linked to the delivery of health services, such as the New Zealand Public Health and Disability Act 2000.
Right to health is more important than other rights. Firstly, we can explain this based on a generational rights argument. The right to health is traditionally regarded as a second-generation right within the hierarchical order of rights, meaning it's supposedly less important and requires more than just non-interference by governments. In recent times, however, the generational approach to rights has been critiqued as being historically inaccurate, analytically unhelpful, and conceptually misguided, because many first-generation rights require the government to step in and fund mechanisms to ensure the rights are upheld. Based on this, it can be determined that there is no reason to say that the right to health is less important than any traditional first-generation right, and in fact could be regarded as just as important, if not more. Secondly, we can illustrate the importance of the right to health based on the concept of composite rights. As a composite right, the right to health is multidimensional. It entails the right to a much broader notion of health, meaning a complete physical, mental and social well-being. Because the right to health relies on underlying social and economic determinants of health, it can encompass within it some much narrower rights, which make up a broader right to health. These could include the right to life, right to water, right to rest and leisure, right to work, right to equality, and freedom from slavery. The collective nature of the right to health and incorporating other rights can lead to it being regarded as potentially the most important right, as it touches on so many significant aspects of our lives. Finally, in comparing the importance of the right to health to other rights, the right to health is fundamental because without the realization of a complete physical, social and mental well-being, other rights are seemingly meaningless and in some cases will not be able to be realized.
The right to health was first recognized in the 1946 Constitution of the World Health Organization, followed by the 1948 UDHR. Both gave broad definitions of the right to health. However, due to ideological differences during the Cold War, this expansive conception of the right was narrowed under the 1966 ICESCR, which only required progressive realization by taking steps to the maximum available resources. Since then, the right to health has been reaffirmed by by states in the 1978 Alma-Ata Declaration and the ECSR Committee's General Comment 14 in 2000, which recognized the right beyond preventative health care to include food, housing, work, and equality. This shift back to a more expansive conception was largely a consequence of the HIV/AIDS crisis, which demonstrated the link between health and other socioeconomic factors. There have also been further efforts to cement the right to health. The Framework Convention on Global Health proposed in 2008 seeks to reduce health inequities by setting out standards to achieve conditions for good health and ways to finance measures to support the right. Domestically, there has been significant advocacy for a codified right to health, as only 56 countries have included it in their constitutions or legislation, and only 24 have ratified the optional protocol to ICSID to allow for complaints, meaning in most countries the right is not legally enforceable. In particular, there has been strong advocacy in the United States for a right to health care. These efforts internationally and domestically, alongside previous actions to affirm the right, demonstrates clear importance and the need for further action.
In March 2020, the World Health Organization declared that the viral disease COVID-19 had reached a global pandemic level. As a universal public health emergency, COVID-19 has presented novel predicaments, caused new vulnerabilities, and intensified current ones. Over the last 18 months, the pandemic has cemented the importance of the right to health. As stated earlier, the right to enjoy the highest attainable physical and mental health standard provides obligatory normative guidance for healthcare procedures, wider civic behaviour, and universal camaraderie. Per the right to health, states should act for the prevention, treatment, and control of epidemic, endemic, and other diseases, and to guarantee medical service and medical attention in the case of sickness. The right to health has affected not only domestic policy, but also international procedures. Based on the purpose of the ICESCR, states should work collaboratively to mitigate the threat of COVID-19 and support healthcare systems. The right to health is more important than ever for providing a set of clear principles for setting and evaluating necessary health policies and actions. Incorporating mainstream human rights into healthcare programs and policies on national, regional, and international levels has been imperative in the effort to combat COVID-19.
In conclusion, we have clearly demonstrated why the right to health is the most important human right. Its expansive scope and status is a fundamental right without which other rights cannot be enjoyed, and the example of its importance during the COVID-19 pandemic have clearly proven this. Overall, the ultimate aim of a happy and fulfilled life is impossible without it.